Hi everyone. Today I'm going to be presenting for my SOAP patient SL. He's a 37-year-old male Caucasian who came in complaining that he woke up with a stabbing right toe pain that was severe. He denies any precipitating events, states that over the weekend he just had some beers, went to a football game with a couple of his friends and was having no pain at that time, denies any trauma, falls, or any other episodes. He does state that he took 1,000 milligrams of Tylenol this morning when he woke up with the stabbing pain and that it did not give him any relief. He has no known drug allergies, only past medical history is GERD that he was diagnosed with in 2012, and he takes Protonix 40 milligrams PO daily. He lives with his wife and 2 daughters. He's a utility engineer at a local electric company, and he denies all drug use, tobacco use, and just an occasional drinker, mainly consisting of a 6-pack of beer on weekends. Review of systems, he was pretty negative all the way, except for musculoskeletal, obviously. He denied muscle pains, denies any trouble walking until today, with just minor caution due to the toe pain. State that pain is of stabbing type and throbbing to the right medial great toe. That started overnight. He denies any involvement with the left foot or any other phalanges, denies any trauma, burns, or falls, and denies that this has ever happened before. Neurologically, he denied any weakness, nerve pain, numbness, tingling, or any other issues. And then skin, has had no skin changes except for that right foot, where that right medial great toe is experiencing some erythema and swelling and a little bit of warmth. Vital signs were good. He's 37, weighs 238 pounds, pulse was 76, blood pressure was 120/82, and his pain was 8 out of 10 to that right medial great toe. Physical exam was pretty negative throughout all the systems until you get to musculoskeletal. Upon walking, his gait's pretty stable, just a little guarded from the pain to that right toe. The toe does appear to be edematous, erythemic, warm to touch, and then of course tender to touch. There's no other toe involvements, and then left foot compared to the right is completely normal. The patient does have full range of motion to all his phalanges and feet. Other than that, skin was appropriate in color, texture, and turgor with no other interruptions. Because of his age, history, and the precipitating events, we diagnosed this patient with gout, mainly because of the clinical presentation of the tophi and everything. Differential diagnoses would be septic arthritis, trauma, cellulitis, and rheumatoid arthritis. As you know, gout is the buildup of uric acid, in the blood, usually caused by precipitating events like an intake of high purine rich foods and drinks. Usually occurs acutely overnight, which makes sense for this patient waking up in the middle of the night with stabbing pain. We did do a uric acid blood test, and it was elevated at 8.6. My preceptor just chose, because of the patient's age and the clinical presentation, along with the blood test being elevated, to just use this for diagnosis, although the gold standard for diagnosing gout would be to send off synovial fluid. Pharmacology-wise, we gave the patient an NSAID, which is first choice for an acute treatment. For an acute attack, we gave him naproxen 500 milligrams PO BID for 10 days, told him to take it until the symptoms resolved or until the 10 days was up, and then started him on maintenance medicine of allopurinol 100 milligrams PO BID daily. Did a lot of education about foods, non-purine, rich foods and drinks such as alcohol, meats, especially organ meats, yeast, beans, oatmeal, spinach, mushrooms, all of those things. Did a lot of education on staying very well hydrated, taking up to 2 liters a day to precipitate any events, and then also did education on the medications. No referral is needed for gout. We are just getting this patient to follow up within 30 days to make sure that the acute attack resolved and see how he's doing on the allopurinol and take a look at that. Right medial great toe again. He had no concerns or religious, cultural, financial reasons that this treatment wasn't the best option for him. So this is what we went with. Thank you.